Hi, my name is Paul Elmslie. I'm the founder and CEO of HealthCert, and I want to thank you for taking the time to learn more about the new CPD requirements and to look at some easy ways to comply with them. So what are the changes to CPD? Well, very first, the CPD program of the past was a triennium where we had to collect a number of points and submit them. Now that system has changed to collection of a number of hours over a 1-year period with some very specific requirements. The first requirement is that you need to submit a professional development plan, and the professional development plan that should then guide the CPD activities that you would then undertake. You need to complete a minimum of 50 CPD hours over the year, and they're broken up into these parts. The first part is the education activities, so a minimum of 12.5 hours of educational activities that aligns back to your professional development plan that you created earlier. You then also have to conduct performance review activities and also outcome measurement activities, and you have to do at least 5 hours of performance or outcome measurement activities, but the total of the two, performance and outcome, needs to be a minimum of 25 hours. Then the balance of the 12.5 hours can then be spent on any one of those three areas of education, performance or outcome measurement. Now, as a GP specialist, you're also required to do life support every 3 years. Now, so what are some of the different CPD activities? Well, just very simply, educational activities, basically knowledge and skills based, and these are activities that expands the knowledge and skills that you have. And they're conferences, workshops, courses, podcasts, lectures, or case-based discussions. Looking at activities that measure outcomes, so these are the evidence of outcomes, and this is using you working with data to ensure quality results. So these are mini audits, plan, do, study, act, research, practice accreditation, or development of clinical guidelines. Some of the performance review activities, as an example, are activities that require reflection on feedback about the practitioner's work. So they can be case-based discussions, peer group learning, patient feedback, and a number of other activities. So multi-source feedback is another one you can do. So that sounds like a lot, and obviously it's relatively complex and there's like different activities you do have to do, but we're here to help and try and make it as simple as we can for you. So we're going to be able to provide for you a free professional development plan builder and an hours tracker as a resource. The other way that we can help you is in relation to getting the 50 hours in an easy form is to look at HealthCert courses or look at HealthCert 365, which I'll explain to you in just a moment. Plus, we also still have our very popular practical skills workshops as an option for you to be able to attend. Now, our certificate courses, which have been running since 2006, are probably the easiest way to meet the 50-hour requirements, because the certificate courses include the mandatory education, performance and outcome measurement activities all in one program. The content is university quality assured, and at the bonus at the end of it of completing all these activities, you get a certificate to put in your practice and also in your biography. And also, if you've got an interest in subspecialisation, the courses then provide you a pathway to subspecialise in primary care. But that's an additional benefit outside of getting all of the 50 hours in one particular course. Now, as an example of some courses, we've got here the Professional Certificate in General Dermatology, and you can see that we've got the education, performance and outcome measurement activities that easily comply with the 50 hours that's required. Here's the Advanced Certificate as another example of a course that once again has all the 50 hours, and this is the Professional Diploma of Women's Health also, which once again has all of the hours that are required. But I'd also like to introduce you to HealthCert 365. So this is a new service that we're offering doctors who want to comply with the CPD, but maybe don't want to do a certificate course. So think of it a little bit like Netflix for CPD activities, where there's 185 plus education, performance and outcome measurement activities all available online. And they're in 19 different areas of primary care medicine. The content is taken from our courses. We've broken them up into different modules from the various courses, and it will provide you with over 2,000 hours in total of resources or activities you can pick from. And all you've got to do is pick the 50 hours that are of most interest to you and align back to your professional development plan. And the cost is a low annual fee, which is less than a cup of coffee per day. Now, the workflow of HealthCert 365 is relatively simple. You click on the registration link, fill in your details, get access to the portal, build your professional development plan builder, select the activities from the menu that fulfill your requirements, and you have a choice of going in and just picking the individual activities based on your interest, or we've got templates with specific topics of interest which you can click on, which will then give you the 50 hours. Now, the way the system works is the system also tracks your CPD hours and shows you once you've got enough. So when you go in and select these activities, it'll show you at the top whether you've complied with the minimum requirements to get the hours that you need to do. Once you've done that, it then enrolls you in activities, and then it takes you back into the learning management system where all the content is. We also send you an update every month of the activities you've completed so you can keep on track. We're just conscious that doctors are time poor and busy. It would be hard to keep track as to where you're up to with your 50 hours. And if at any point in time you need any help whatsoever, just please call or email our CPD help desk. So one of the other options that you have as a doctor to get to your 50 hours is to look at the practical skills workshops. So these are for doctors who want to develop practical skills in skin cancer, aesthetic medicine, clinical procedures and other areas or topics. Now, these generally account for 6 hours per day towards your CPD. So it's very helpful if you just want to get a block of CPD done in a particular day whilst developing more skills to develop or manage complex conditions and also potentially grow your revenue. So the benefits of basically looking at HealthCert Education as a provider or a solution for your CPD is it's easy to use, particularly designed so that it's all in one place. So you've got everything you need to do with relation to all your CPD in one place. So it's easy to track and then to be able to utilise and participate. You can choose between doing a certificate course, which has everything included in it and requires no thinking whatsoever, or you can choose your own adventure through HealthCert 365 and pick from the over 2,000 hours of activities. And all your CPD requirements will be tracked, and also you'll be sent reminders to help complete your CPD on time. So if you want to learn more on how we can help you, please click on the link below or contact one of our education advisors who can provide you the personalised assistance that you may require. And I want to thank you for your time and good luck with relation to completing your CPD this year.